Hi, I'm Rana Jaraha, here for iTubeOD's daily coverage of the Vision Expo East meeting in New York. I'm joined by Dr. Richard Adler, who's a cornea specialist at Belcara Health in Baltimore. Dr. Adler, thank you for your presentation about the psychology behind dry eye and the role of diagnostics. Do you mind giving a summary of your presentation?
Of course, thank you very much. This is an aspect of dry eye disease that I think all doctors know about, but we rarely think about in a formal way. There's something about the dry eye patients that just tends to be a little bit different than the average cataract patient or glaucoma patient, and doctors oftentimes almost have an emotional reaction to it. One of the challenges that separate dry eyes from other disease states is that it tends to be a little bit more amorphous, more ambiguous, without a clear beginning, a clear end, and without gold standard tests. So we have patients who come to us with some baseline anxiety that really impacts how they experience their disease. In fact, the way a patient perceives their disease tends to truly impact their experience. And dry eye, as far as diseases go, is unique. We have folks who do take up a lot of chair time and are very anxious about their disease. We know these folks. Those are the folks we typically stereotype. But on the other hand, we have folks who have very little anxiety about their disease, tend to dismiss dry eye as not important, and move on without adequate treatment. By recognizing which patient type you're dealing with, you can much more effectively treat the patient. So what we're learning here is that there is truly a connection between anxiety and depression. This has been borne out in multiple studies this year, and dry eye disease, and that for doctors who manage dry eye disease, we need to continue treating the inflammation, considering the aqueous, the lipid, and the meibum, but we can't also forget that behind each and every eye, there's a person with unique needs, unique perspectives, and their baseline anxiety and their baseline perceptions of their disease are going to impact their disease experience, and we as doctors always need to remember that when we customize our care for our dry eye patients.
Dr. Adler, thank you for bringing awareness to this topic, and
You're welcome.
Thank you for joining us.
Thank you.